Amoxicillin is one of the oldest antibiotic in current clinical practice. It inhibits the bacterial cell wall synthesis, leading to lysis of the bacteria, which is the mechanism by which it actually functions. The clinical usage of the drug has come down substantially in view of the prevailing antibiotic resistance, but still it has relevance in certain infections which are mild to moderate, especially those of the ear, nose, throat, like uncomplicated otitis media, milder sinus infection, and tonsillopharyngeal infections. Can also be used in focal mild skin and soft tissue infection and uncomplicated respiratory infection. The dose is capsules of amoxicillin given as 500 milligram thrice daily. The conventional dosing of 4 times daily or 5 times daily is not required. 3 times daily are effective when used for these infections mentioned. The capsule can be taken along with food. And the point you need to remember is that it controls infection when started early. So when you feel that the infections are progressing or little advanced, better not to go for oral amoxicillin. Rather, you opt for higher antibiotics. It continues to be of relevance in the eradication of Helicobacter pylori infection. The dose is 1 gram twice daily, and it is given along with clarithromycin and a proton pump inhibitor. It continues to be a well tolerated regimen for Helicobacter pylori infection eradication. For endocarditis prophylaxis for invasive procedures, for at-risk patient, the dose given is 2 gram 1 hour before the procedure. Generally, it is well tolerated. Diarrhea and skin reactions are the common adverse effects. Diarrhea is more common than the skin reactions. The rash is especially common in patients with infectious mononucleosis caused due to Epstein-Barr virus. Sometimes it can be due to a hypersensitivity reaction, which can be a little bit more severe, and it can produce erythema multiforme or even Stevens-Johnson syndrome and toxic epidermal necrolysis. The latter two are relatively severe cutaneous reactions. Unfortunately, we don't have any clinical predictors of these adverse effects. Some literature tells that when used concomitantly with drugs which can cause hypersensitivity like allopurinol, it can produce, but except for the history of allergy to penicillin agents, and nothing else is really reliable to predict these things. We know that the drug causes pseudomembranous colitis, but the point I need to emphasize here is that it can occur even 2 months after the completion of the course of antibiotics. So the drug should be in mind when you face a patient with hemorrhagic colitis, even a remote history of use 2 months prior to the current episode. Use of the drug in special situations. It is safe in pregnancy. It falls under category B. No dose adjustment is required in liver disease. In kidney disease, if the creatinine clearance is more than 30, nothing has to be done. You can give the usual thrice daily dose. Creatinine clearance between 30 and 10 ml per minute, you decrease it to a twice daily dose. And when it goes below 10 ml, you give a once daily dose. About 30% of the drug is dialysable. So when the patient is on dialysis, you should give an additional dose after dialysis, and if you can time it, you can give the drug after dialysis. You can see more videos on clinical therapeutics and many other clinical concepts in medicine.